Well, as the U.S. economy continues to move ahead, demand for cosmetic surgery is also on the rise, apparently. A new study finds that the number of Americans seeking cosmetic surgery has grown as the economy is rebounding. Dr. Stephen Hopping joins us this morning to talk about what women are looking for and how they're choosing their surgeons and all the things that are going on. And you tell us that still, after a decade, liposuction is the #1 requested surgery. Is that right?
Yes, a survey from 2009-2010 by the American Academy of Cosmetic Surgery. Liposuction is still #1, up about 3% from previous years.
And what areas of the body are people looking at most to get improved?
Men, it's always the abdomen and love handle, flank area. Women, it's thighs, or it can be the abdomen, but women have their fat in more diffuse areas. This is a film of liposuction being done. This is a surgical procedure, though. But the new twist is laser lipo and vasor lipo, which allows us to do smaller areas under just local anesthesia. And that's part of the increase in liposuction.
And what is the recovery time for that?
Again, you're bruised. The nice thing about liposuction is under your clothes, so you can do it on a Thursday, be back to work on a Monday. Now, under your clothes, you have bruising for a couple of weeks, of course. Yeah. You wear a garment for 2 or 3 weeks, but people are back in the gym in a week. So it is a quick recovery, especially with the new laser liposuction.
How expensive is it to have, well, as much as you can get?
Depends on the number of areas you do. It can be as little as $3,900 to as much as $9,900, depending on the number of areas you can do. There is a limit to how much fat we can remove.
And even in this economy,
4,000 to 5,000 cc's.
You've seen the numbers growing of people who are asking for these
Absolutely.
surgeries. Can you borrow money for this kind of thing?
Yes, there are. You can actually, well, you can borrow money from your own credit cards or your own.
Right. Well,
but yes, there are financing companies available for this. Yes.
That's what I had heard. Now, are women considering less invasive ways of getting rid of the fat these days, like the laser lipo, which you've mentioned to us before?
Well, laser lipo, but it is still surgery. But yes, it's considered less invasive, faster recovery, and of course, then the non-surgical, Zeltiq, Zerona. Again, they're not as dramatic. It doesn't get rid of as many of the fat cells. You're not going to lose as much inches, but then again, it's not surgery.
Now, you say that the second most requested cosmetic surgery in the latest study shows that eyelifts.
Eyelifts, yes.
Has that been true, too?
Well, I think that as the baby boomer generation is getting older, you know, our eyes are the first thing to age. So here we have everybody, men and women, do this procedure to
That's
look
the
fresher.
before and after. There is a difference.
Yes.
Definitely a difference. How expensive is that?
Eyelid surgery, again, runs somewhere between $5,000 and $7,000, depending on whether you need anesthesia or whether it can be done under local anesthesia.
Now, this is different from a full facelift, correct? When you get the eyes done,
right? This is just the eyes. And the nice thing, Barbara, is that great longevity with eyelid surgery. Most people do their eyes once a lifetime.
Oh, really?
Yes.
So they don't have to do it again. And usually, do they do that with a facelift?
Many people would do it, or again, some people, this is the first part that ages, so it's in the 40s or 50s, or sometimes they'll combine it with a facelift.
Now, what is the average age of patient? I know all this came out in the study,
right,
of people coming to a plastic surgeon looking for something.
Well, rhinoplasties, it's in the teens and the 20s.
Which is a nose job,
the nose, right. Eyelids, 40s and 50s. Facelifts, 50s and 60s. Liposuction, the whole gamut.
Now, you say breast augmentation came in after eyelifts. Breast people still wanting to get their breasts done.
Right, there
is there still the issue about
lifts,
saline versus silicone?
Well, I think silicone is it's no longer controversial. It is here to stay. The implants are much better than before, and a lot of people feel it gives you a more natural feel and look.
Is it true that the further west we go, the larger the breast size people are asking for?
It's true, and well, of course, Texas also has some pretty big ones too.
Gotta touch Texas. All right, coming up, 4th facelifts. We understand, huh?
Yes, facelifts #4. Again, still the gold standard for facial rejuvenation. We talked about the liquid lift last week. Well, if you want to look, you know, fresher or a year younger or 2 years younger, you do the liquid lift. But if you want a dramatic change, 8 to 10 years, you do a facelift. And
then coming in 5th of all the things that people are asking for, rhinoplasty, which we just said is the nose job.
The nose job, you know, again, it's up 3%, I think it was, from the previous year's study. Men and women, all ages. It's a permanent procedure. Once it's done, it's there forever. Well, it's always great to see you, Dr. Hopping. Thank you for coming in and sharing. It's such a pleasure to be here and be with you. Well, we love seeing your pictures, your before and after. Have a great weekend. Great. Thanks a lot. You too.